Alright, so let's get into vasopressin and what it is and why it is used in the ICU. So quick disclaimer, the information provided in this video is for educational and informational purposes only. I'm not providing medical advice, diagnosis, or treatment. Although I am a healthcare professional, this content should not be used as a substitute for professional medical advice from your own healthcare provider. So what is vasopressin? Vasopressin is an antidiuretic hormone and a ICU vasopressor. Its mechanism of action is that it acts on V1 receptors in blood vessels, causing vasoconstriction, and this helps increase systemic vascular resistance, also known as SVR, and subsequently increasing blood pressure. It also acts on V2 receptors in the kidneys, promoting water reabsorption, although this effect is typically not the primary reason for its use in the ICU. So what are some indications and dosing for vasopressin? So vasopressin is commonly used in the ICU for vasodilatory shock. An example of this would be in septic shock patients that are refractory to catecholamines like norepinephrine. It's often used as an adjunct to reduce catecholamine dosage and limit side effects. It's also seen to be useful in post-cardiac arrest patients to support blood pressure during post-resuscitation care, as well as in diabetes insipidus patients by reducing urine output and preventing dehydration. The dosing for vasopressin is commonly through continuous infusion. This is typically administered as a continuous IV infusion at 0.01 to 0.04 units per minute, and dosing should be carefully titrated based on the patient's hemodynamic response. For this drug, it's important to know that you want to avoid bolus dosing, as bolus dosing can cause severe hypertension and myocardial ischemia. So what are some side effects to be on the lookout for when utilizing vasopressin in the ICU? So firstly, you want to be on the lookout for ischemia, and this is because vasopressin can cause excessive vasoconstriction, leading to ischemia in organs such as the heart, kidneys, and intestines. The second would be hyponatremia, and this is due to its antidiuretic effect. Vasopressin can lead to water retention and dilutional hyponatremia. And lastly, you want to be on the lookout for arrhythmias. And while less common, it can cause arrhythmias due to its effects on vascular tone. Alright, so let's look at some contraindications as well as cautions when using vasopressin. So we want to be cautious when using this medication with patients who have coronary artery disease. And this is because patients with coronary artery disease are at a higher risk of inducing myocardial ischemia with the use of vasopressin. We also want to be careful with patients who have chronic renal failure, and this is because due to their renal impairment, they may be more susceptible to the drug's side effects. And lastly, we want to gradually taper vasopressin. So vasopressin should be weaned off slowly to prevent rebound hypotension, and it's often weaned after catecholamines are first reduced. So what are we going to want to be monitoring with the use of vasopressin in the ICU? Well, first we want to monitor our hemodynamics. So we want to monitor our blood pressure, heart rate, and urine output closely. We also want to monitor our electrolytes, such as our serum sodium and potassium levels, and this is because vasopressin, like stated earlier, can cause hyponatremia and different electrolyte imbalances. And lastly, we want to monitor for any signs of ischemia. So we want to watch for signs of myocardial or mesenteric ischemia due to vasopressin's potent vasoconstriction. And that is all for vasopressin. Thanks for watching, and please feel free to leave a comment on any ICU medications or devices you'd like to learn about in the future.